Hi, my name is Natalie, and I'm going to be your nurse today. I'm going to close the door for privacy. I'm going to perform hand hygiene. For this, could you please verify your name and date of birth for me, please?
I am Robert Chinchilla. I was born in April 14, 2006.
Awesome. So today I'm going to be performing a head-to-toe assessment. And for this, I'm going to be using my stethoscope, and I'm going to be using my pen light as well. Okay, so before we get started, do you know where you're at today?
The hospital.
The hospital. Do you know what day it is?
March 14,
Do you know what year we're in?
2020.
Who's the President of the United States?
Donald Trump.
The patient's alert and oriented times 4. Are you currently feeling any pain? If so, on a scale from 0 to 10, with 0 being no pain and 10 being the worst pain you could possibly imagine, how would you rate it?
0.
So the patient stated 0. He does not seem to be in distress or anything. Do you have any allergies to something, anything
No.
that I should be aware? Okay. So I'm going to perform a head-to-toe assessment. I'm going to begin by inspecting your hair. Is that okay with you?
Mm-hmm.
Okay. So by inspecting his hair, I want to make sure that I get in there really good. Look at his scalp. I do not notice any lesions or infestations or anything. His hair is nice, beautiful, normal, distributed. So now I'm going to look at his face. I'm going to inspect his eyes, his nose, his mouth. I notice that his nose doesn't have any deformities or anything. I do want to make sure I look at the underlids of his eyes. They're pink. I do want to look at his ears as well. I do not see any deformities or anything, which is good. They're where they're supposed to be. Now I'm going to perform an eye exam. I'm going to flash a light, and I'm going to make sure that your pupils do constrict and dilate. So look at me, please. Okay. Awesome. Okay. Awesome. So I'm going to ask you to follow my pen light, okay? Don't move your head, just follow my pen light. Okay. Now I'm going to ask you to look at my pen light and look at the back wall. Straight ahead, just straight back. Pen light, straight back. Okay. So perla is intact. I did test for accommodation as well. Now I'm going to ask you to follow or to get your pointer and then point at my finger. Your nose to your nose and my finger. Back to your nose and my finger. Okay, so that's good. So I'm going to ask you to open your mouth for me and say ah.
Ah.
So his uvula does rise as expected. I don't see any lesions in his mouth or any sores or anything. It's pink and moist. So now, can you smile for me? Can you frown? Can you puff out your cheeks? Can you clench your teeth? Can you purse your lips? Okay. Can you raise your eyebrows for me? Okay. So now I'm going to ask you to push with your tongue against my side. Okay. This side. Okay, awesome. Have you had any difficulty swallowing lately or anything?
No, ma'am.
No. Can you swallow for me? Okay. So I do notice that his face and his neck are symmetrical. I don't see any lesions or anything. Could you shrug your shoulders for me? Okay. Again. Okay. So that's good. So now I'm going to ask you to turn around. I'm going to perform what is known as the whisper test. I'm going to ask you to cover one ear for me, and I'm going to repeat what I said. Okay? Ready?
Bananas.
Okay, cover the other ear.
Apples.
Okay. So turn around for me. Awesome. So the patient did pass that exam. So now I'm going to ask you to take off your shirt for me. And then before we get started, can you move your neck from side to side, up and down? Okay, awesome. You don't feel any pain or anything? No, okay. So I already inspected that. I'm going to inspect his anterior and his posterior chest. I don't see any lesions or abnormalities or anything. Have you had any shortness of breath lately?
No, ma'am.
No, okay. So I'm going to take a listen to his lungs. I'm going to clean my stethoscope. Okay. Ask you to take a deep breath for me. Okay. Okay. So normally this would be your bronchioles. These right here would be your vesicular, and this right here would be your bronchiovesiculars. So I'm going to ask you to turn around for me, and I'm also going to take a listen to his back. Take a deep breath for me. Okay, awesome. So I'm gonna ask you to turn around. So now I'm going to take a listen to his heart. And I'm also going to inspect and make sure that I don't see anything abnormal in the skin or anything. So I'm going to listen the aortic valve, the pulmonary, tricuspid, and the mitral, which is also the apex of the heart. Okay. So I didn't notice any abnormalities or anything. Have you had any chest pain or anything? No? Okay. So I'm going to inspect his skin. Make sure I don't see anything abnormal, which I don't. No lesions or anything. Check his capillary refills, which they are less than 3 seconds, and they are brisk. I'm going to check for his range of motions. Can you stand up your arms for me? Do circular motions. Do you feel any pain? Do it other way. Okay. So now I'm going to inspect for his strength. Can you push down? Okay. I'll push up while I push down. Can you grab my fingers? I'm going to push and you push. Okay. Now I'm going to push and pull. Okay. So strength is 5 to 5 is equal bilaterally. I'm going to check for his radial pulses. So there are 2+ bilaterally. I'm going to do his brachial. And they are 2+ bilaterally as well. Okay, so now I'm going to ask you to lay down for me. And I'm going to inspect his abdominal area. So I want to make sure that I don't see any pulsations or anything, or any lesions or anything abnormal. When was your last bowel movement?
2 hours ago.
Okay. Did you have any difficulty while urinating?
No, man.
What color was it?
Yellowish.
Yellowish. Okay. So yeah. So now I'm going to take a listen to his bowel sounds, and I'm going to begin by the right lower quadrant. When you are not able to hear a sound, you want to make sure that you listen for 5 full minutes. Okay. Now I'm going to listen to the aortic. Okay. So his bowel sounds are equal, or his bowel sounds are active, normal active in all 4 quadrants. Now I'm going to lightly palpate. If you feel any tenderness, please let me know. Okay, now I'm going to ask you to take a deep breath. Okay, inhale. Okay, one more time. And then one more time. Did you feel any pain or discomfort? No, okay. So I was able to do all of that. Now I'm going to percuss. Okay. Okay. So I would also want to percuss. I'm gonna have you sit up. Would also want to percuss his lung fields, which I forgot to do. But normally you would do it in all of the same places that you did take a listen to. And then I'm gonna ask you to turn around for me real quick. And I would make sure. Okay, now I'm going to ask you to, thank you. So I'm going to remove his socks. And I'm going to inspect his skin. Make sure you do have a bruise here. Do you know how you got that?
Yeah.
Yeah, okay. So I just want to make sure that there's nothing big. Okay. So now I'm going to ask you to test his strength. So I'm going to ask you to push up while I push down. Okay. Now push down while I push. Okay. Now I'm going to ask you to push back while I push forward. Okay. Now push forward, I'll push back. Okay. And then I'm going, so his strength is 5 out of 5 equal bilaterally. I'm going to check for his popliteal pulses. And they're 2+ bilaterally. I'm going to check his tibialis pulses. They're 2+. And I'll take his pedal pulses as well while I'm at it. And they're 2+. I'm going to check his capillary refills. And they are 2+ as well. Okay. So now I'm going to ask you to lay down. Do you have any difficulties moving your legs?
No.
So I'm going to bend this knee. Move it forward. Okay. Awesome. Okay. I'm going to ask you to stand up for me. And I'm going to ask you to walk. front and back twice. So I do notice that his gait is normal. I don't see any off balance, tipped off or anything. Just by looking at his height, I know that his height is adequate for his age. I do notice that his nutrition is also well and healthy. And he was responding to me, looking at me, making eye contact, and he was responding well. So his behavior was normal as well. Now I'm going to ask you to put your feet together, close your eyes, and extend your arms. So I do notice that he doesn't sway or anything, so he does have a good balance. This is known as a Romber's test. I'm going to ask you to sit down, and I'm going to ask you to close your eyes, and I'm going to ask you to smell something for me, and you're going to let me know what it is, okay? So what is that you smell?
Clorox wipes.
Clorox wipes, awesome, thank you. So now I'm going to ask you to lay back down in bed. So normally in a hospital setting, I would cover up the patient, with his blanket and everything, lower the bed. I would open the curtain. I would perform hand hygiene, clean my stethoscope. I would make sure that there's no hazards in the environmental area. And then I would ask the patient if they would want me to leave the door closed or open for them. I would give them their call light button, and if you need anything, just know that you can push that button and let me know. Other than that, I think you're good to go. So you didn't have any difficulties or anything. You were able to move your neck, your legs and everything. I did listen to your bowels. I did your heart, your respirations. I did Perla. Did the whisper test. You did the tongue protrusion. Yeah, so this is what we would call a head to toe assessment.